Hello and welcome back to SimCast, the Higher Education Simulation Podcast. My name's Lawrence Hill and I'm the chair of the Simulation Group in the School of Health Sciences at UEA Norwich.
Hello everyone, my name is Tony Jeremy and I'm the academic lead for simulation-based education at UEA Norwich.
And today, on today's episode, we are very happy to be joined by Jacqueline Maria Diaz. Jacqueline, if you'd like to say hello to everyone.
Hi, nice to be here. I'm happy to be part of this SimCast. Thank you
Jackie.
for the opportunity.
No, thank you for joining us. We're really excited to have you on the show.
So, Jackie, you're an associate professor in nursing at the University of Sharjah, and you're chair of the Department of Nursing for both the undergraduate and the postgraduate programs. And in addition to that, you are an honorary associate professor at the University of East Anglia.
That's correct.
Great, good. So today's episode of SimCast is in fact coming from the UEA, but speaking to someone in the UAE, which is
It's a bit of a tongue twister.
I love that.
Yeah.
Okay, great. So if you're enjoying this podcast and you think other people might like it too, please do like it and subscribe to keep in touch with all of our SimCast related content. Jackie, can you tell us a little bit about yourself? What is it that brought you into doing what you're doing now?
One of the things that I realized was that I've always been a clinical teacher for the greater part of my life. I've been an educator, been on the clinical area for the last 32 years as a faculty. And I've always realized that students do not get a standardized experience. Every student does not get the same experience. And that actually motivated me to learn that what can be the answer for that? How can we give students in the undergraduate program a uniform experience that they can go into the clinical area and be competent as bedside nurses? And that actually the world of simulation opens up. I mean, everyone does not get the same clinical experiences. They, fumble on the way. Sometimes, they make mistakes. And you can practice, in a safe environment. And there's that whole element of psychological safety in simulation. So that actually motivated me to, learn that there's something called simulation. I mean, I came from a time, when everything was done on task trainers and in a skills lab. So this concept of simulation is very new, it's novel, and I think we can help our students to reach a level of proficiency. So that's where my idea of simulation came from. And I believe I've been blessed because I got a lot of opportunities to visit a number of simulation centers all over the world, including I've taken simulation training in Boston. And that kind of opened my eyes to the whole world that, we can do many things that we don't do. And students can practice in a safe environment. They can make mistakes. Of course, they have to be accountable for their mistakes, but they can go through the whole process and, be better practitioners. And my work has been not just with nurses, but, using an interprofessional forum. So, working with doctors, working with residents, physiotherapists, all kinds of healthcare professionals. And we've seen it because when we've been able to introduce simulation, we've seen that there's been a change in the results and they come out more confident than, when there was no simulation around. So does that answer
fantastic.
Your question?
Yeah, absolutely. Yeah. I mean, and I think it says a lot about why you do what you do, as well as
I was just going to say there's just heaps of passion there, isn't it? When you explain what you do. Let's look a little bit more about why you do it. What's that fire in your belly?
Let me give you a context from the United Arab Emirates. I have in a class. I have 80 male students. Now, given the conservative Arab culture, no male student is ever going to be allowed to go into the maternity ward unless he himself is going the father of the child. Now, how do you give this? Yet they have to pass the baccalaureate curriculum with a course in maternity. So how do we provide that? They're never going to see the inside of a labor room. Yes, they can see a YouTube video. They can do that. So what we have done, and since I've been here in the United Arab Emirates, we have created the scenarios to mimic the actual world. And so they actually, we have, the mannequin, they go through the stages of labor. We have them look at people prepartum. We look at them postpartum. We look at, a cesarean, a normal SVD, and we put them through the stages. We have, and what we do is, the way we do it, we have our own students, because pretend. So, for example, doing an assessment, some of our students we always have 2 or 3 students who are pregnant, in different stages of their maternity. So they're very happy to help the boys and, be there, help them to, take so they do an antenatal assessment. We don't have to hire, simulated patients. We have our own female students. So we use the concept of collaborative learning, and we use this. Having said that, I actually received the teaching award from the Chancellor to do this. And that enabled us to do much more, in terms of it. So we've actually done a lot of work with helping the male students. So at one time, a couple of years ago, there used to be 8 students in the male. Today, I have 80 males in one academic year. So that has to be done. So this way, we do take them. They see them just a walkthrough, but the actual learning that takes place goes through in the simulation. So that has enabled us to have a uniform learning experience and as close as possible to their female counterparts.
Yeah, and simulation is such a powerful pedagogical tool there for kind of crossing that kind of the gap that these learners wouldn't otherwise have had that experience.
The messy reality of the world that we live in, and some of the nuances that
And ultimately, I suppose that's of benefit to the future patients as well, because the first time these doctors could be in a situation where they might need to practice these skills, this is their opportunity to have some form of experience to draw on. Oh, that's really interesting, and huge credit to you as well for that Chancellor's Award, because I think that's a ringing endorsement of what you're doing. Congratulations.
What are some of the other responsibilities that you have now in your current organisation?
In terms of simulation or in general?
Yeah, in simulation and also in general.
Yeah. See, in general, we are going through. We've just completed a needs assessment for our PhD program. So we hope to embark on a PhD program at the University of Sharjah. We've also done a reformation of our Masters in Adult Critical Care program. We're waiting for, and that again, we had actually people from University of East Anglia who are on our board and on our advisory board and were curriculum experts. So that was wonderful. We worked together and we reformed that curriculum. And our undergraduate curriculum, it's very interesting. For the first time last year, we have now a competency-based curriculum, which we did not have. It was primarily a didactic. Now, in the competency-based curriculum, which has come out and that's going to be uniform across the United Arab Emirates, we are having 120 hours of theory, and there has to be 1,600 hours of clinical. At present, we have about 1,000 to 1,100. Now, there's been a realization that we need to have more clinical in order to make the students proficient again at the time that they graduate. So what we've done and what we've been advised to do is to have simulation. So it's coming at a time where we've actually introduced simulation into all our courses. And that has been integral to building up simulation for not just the maternity course, but any course. So again, we worked very closely with University of East Anglia, with your faculty to introduce it in critical care and in many other courses. So that has been actually the hallmark where we've learned to work together and we've been able to improve the career, of course, there have been challenges, and I'll talk about that later, I'm sure. But we've learned that, we need that buy-in from the faculty. We need the buy-in from the administration to set up simulation and to make it as, where does simulation, quote unquote, fit inside the curriculum?
Definitely some parallels, isn't there?
Huge parallels there with a UK context, and it's music to my ears. I'm sure it is to Tony's to hear about simulation being designed into the curriculum from the ground up. That's brilliant. But one of the things that we really wanted to talking of shared experiences, the kind of I suppose the body of today's podcast really is that we know that you have had a key role in the building and the setting up of a simulation center in Pakistan in a previous job. So we thought it would be really interesting to hear about that experience and see whether there are any parallels with the UK context, and I'm sure there will be. So you set up a simulation center from the ground up in Pakistan. Tell us about that experience.
Sure. I mean, that's been one of the highlights of my career. I was associated with the project for 10 years. So it was right from, signing off the blueprints before they actually to seeing the first, stone being dug and the inauguration ceremony, and then to see it taking off. So I was associated with the project for 10 years. And the culmination of that project took place on the 27th of November 2015. And what we at that time, there was no concept of simulation. So we were the first center that opened the simulation lab. It was a world-class, renowned facility built in 4 sections. And it was not just for nursing, it was for health professions. So it was, the medicine, there was a dental side. There was also, because if you know where Pakistan is, we also have the mountainous region. So we also had a telemedicine section as well. So people could consult with doctors in the north, in the mountainous regions where it's very difficult to come down and, get treatment. So we actually had a telemedicine presence as well in the simulation lab.
I mean, that's so future focused, so you were signing off on the plans for this in probably 2005. You said roughly,
yes,
if it was 2015 to completion. So, that
it's very forward thinking, isn't it? If you think about some of the kind of landmark papers in terms of clinical simulation coming out in the late 90s, early 2000s, you're really, we're very forward thinking. And perhaps the mountainous regions are where the parallels stop with Norfolk, because we're very flat in comparison.
There's no mountains out there. No, not at all. But the remoteness of the population and the increasing need financially to use telemedicine, and the convenience and the quality of the care that can be provided. So you built that in. So you said there was no concept of simulation at the time.
Yes, so we actually, started from the ground, because we just had skills labs, right? We had a skills lab, we had an anatomy lab, we had those kind of labs and to bring it all together and say we needed a simulation. So we had to write a concept paper, get it approved at the board level, and, what would this center, because people were still fumbling, what would this, actually do for it? And that's when I think the organization invested very heavily in a group of us to take a tour. So we actually toured North America. We came to England. We went here in Dubai as well. It was starting Australia. And I had the privilege of visiting many simulation centers all over the world, where we actually saw what a simulation center was. We also had hired some consultants from, British Columbia and different places who were actually our guiding force as well to set it up. So it was right from, setting up, what would be the infrastructure, to, which are the vendors we should choose, which mannequin would we choose and why. So we did a lot. So I think our needs assessment was very, very intensive. And that enabled us to bring, the best mannequins. Of course, there was budget. We had a budget at our disposal, which helped immensely, but we were able then to do it. So once we were able to set this in place, then we realized that, we need to train the faculty. And faculty,
So we have to say, like, on that point, like there are strong parallels there with the process that we went through here in the UK too. We received, the school, applied to the government for some money. We got a good amount of money to transform a teaching building, existing building.
Yeah, so slightly different. Building. It was an existing building rather than a purpose-built building. But definitely. But then you find yourself in the middle of a simulation centre.
Exactly.
With lots of equipment, and then you realize you have a load of faculty to train. So tell us about that process.
So
what was the process of faculty training?
We tried and identify, simulation champions, those who were ready to invest their time and their energy. We gave them some protected time as well, so that they could, invest in their own self-development. And actually, we got a very good grant, the Provost grant, which enabled, like myself, we went to Boston, to the Center for Medical Simulation. And we actually did the introductory course on simulation, which actually opened my eyes that what simulation is all about. And, that train gave us, right from, your pre-brief to your brief to debrief. And there's so much more than just conducting, a session. And, where do you kind of, fall back? So I think there were about 10 or 12 of us that got the training. And that was very, very intensive training. And that was very interesting, because at the same time, I was applying for my senior fellowship in Higher Education Academy in the UK as well. And I use these as examples to show how, how my own learning has been transformed in the area of simulation. And I think that was something that, actually caught the eye of, at the
And
Higher
it does, though, doesn't
Academy.
it? I really think that becoming a simulation educator changes the way it changed the way I taught everything else.
Definitely.
It changed the way I delivered a lecture, the way that I facilitated a workshop.
So many transferable skills. And we actually talked about this in the previous episode with Amy Wong about scholarly activity in simulation and how much there is there. In terms of transferable skills, but also the scholarly activity which people don't necessarily think about when they're like you were saying, delivering the nuts and bolts of having to put simulation out as a teaching methodology.
So I think that was the turning point in my educational career when I realized that there's so much more. And I learned, I think one of the biggest lessons that I learned was to stay back, move back. You don't, as a teacher, you want to be in control. And I think simulation taught me you're a facilitator and the realness of being a facilitator. So I was like, okay, there's learning, the transformative learning will take place and you don't, jump in every time. And I think that is one of the biggest lessons I learned, and my whole, view of, of education changed. I think that was it with that simulation training. And I believe that I'm a changed person because of that.
And what a golden opportunity to go to the Centre for Medical Simulation.
Imagine that trip to Boston would have been incredible. With that, I mean, that really is an epicenter of good simulation practice, isn't it? So, what a great experience. What was it like there?
It was fascinating. It was like learning something new. It's like learning to walk again because, you did things differently. You had to plan a session. We had to, write scripts. We had to, pilot test the scripts, get sometimes content experts to look at what we've written. And I think one of the things that helped was, we made partnerships and friends in different places, which helped us. And, as you traveled, over the world, I was able to meet so many people who were, and I learned from them. We had to have the cultural context to many scenarios. Bringing that forward is, for example, I taught a course and we started the first course on geriatrics. And we taught that entire course through simulation. And what we had was, maybe this is not something that is there, but so much, we actually had the whole family, we had the mother-in-law and we had the father-in-law there, and how they kind of say this should be done this way. So we brought students the cultural parts of this. So that was something that was very novel. And maybe you could stand and talk about it in a class, but when you actually demonstrate that, so we took the
Is this something that you brought back? Is this something you brought back to a UAE context here? Is this what you're talking about? Is this, okay, great.
So, for example, now when I do the maternity course, I'll have a father who is going to be the father of the baby, one of my own students. And I'll give you one of, it's there on our website as well. He brings the camera and he actually takes a video because he says, when my kid is 4 years old, I'll show him how mom was in so much of pain, So the students have brought these scenarios to make it culturally congruent and, make it as to bring them. One of the things that we brought in is the mother-in-law. The mother-in-law plays a pivotal role in the delivery room. So we brought the mother-in-law, how the mother-in-law acts, how the mother-in-law, and we really have like screaming and shouting and things like that, and how we kind of handle. So we're teaching the students at the same time, there's a shoulder
the complexity. That social dynamic, which is so important to do practice well, effectively in clinic. You've just brought some of those complexity, some of that complexity into the simulation by adding those social dynamics, and I'm sure those simulations are all the more richer for the experience.
So, can I take you back to the simulation centre in Pakistan? So, you've done your research, you've gone all over the world and seen these simulation centres, and obviously you've got an idea of what you might need that would be maybe a little bit more sort of specialist to your needs. Then what happens? Is it the case of the building work starts and you kind of wait and prepare yourself, or?
No, the construction is going on. And at the same time, we engaged, like I said, in this multiple faculty development programs. So with that, we started sending, about three to four people a year for the train. So this happened even as the center was going to start. We knew that. So that happened. The other thing, what we did a number of curriculum retreats with all the colleges, medical, dental, nursing, whatever. And we actually asked them, see where you want to fit, simulation in your curriculum, because this was a new concept. So to have the faculty buy-in, we had to do a lot of preparatory work. So we had a lot of teaching learning forums to teach people how to, even write a scenario, how to write a script, and then, how to deliver it, how to make sure that, you don't just go into the simulation lab and do it. You go a day before, you check if everything, have a dry run, see if everything is okay. Then the briefing and the debriefing was another critical part, because people were not trained in debriefing. So we had to go through that, training piece. So it was like train the trainer kind of thing.
Yeah.
Jackie, did you find that the different schools and faculties agreed with each other when it came to implementing simulation? Were there any difficulties or challenges?
There was times when you could bang your head, but I think
go on. Tell us about the spicy bits. Go on.
That could happen anywhere. But then you
realize
that people realize that, look, we can do something. And I think generally being a new place and, the new thing, the novelty of it, people, we had, of course, I think one of the main things was we had the buy-in of the stakeholders, we had the deans on board, we had the provost on board. So whenever we would, actually look at, what we can do, we had, we had them. And, I think that, also kind of paved the way for people to realize that they needed the simulation. And then, of course, being the only place having simulation, we were open to the rest of the country. So we had people coming from all over the country, coming in to do a simulation center or to participate. We also did something what we will now going to do, Lawrence, and, we had a simulation training. So we had like a educator kind of training. So that helped a lot, where it opened their eyes on, what is and what are the principles that need to be adhered to for simulation.
Whenever we have visitors to our simulation center, particularly when they come from environments where perhaps they don't have the necessary surroundings and an environment, their eyes light up. And I think you can see that there's lots of ideas about how they could potentially use. So there's always that, I guess, underpinning desire to use simulation as a pedagogical technique, but maybe some people just don't have the luxury of having the environment. But it's much more about that, isn't it? And like you said, it's the faculty development, which is as important, if not more so, than the physical environment that you're in.
Right.
Yeah.
And I think one of the other things that we, invested in, Heli, I was the chair of the marketing committee as well. So, we negotiated with all the vendors that, you'll have to do X number of trainings. You'll have to be there to help us, our biomedical engineers. Everyone needs to be helped to, set up the equipment, do that, and, have those trainings. So that also helped considerably, and so that worked actually also in our favor.
Yeah, absolutely. You've got to have all of that expertise in the system, haven't you? And did you have a setup with, so you had simulation facilitators, did you have kind of support teams that you had to employ as well? So simulation technicians and
we had
administrative
IT people,
staff and IT people?
The biomedical, engineers were there on site with us, so we had to have all that support. We did a lot of the, like the IT people who would help with the recording so that people could observe what they did and then, get back and we could discuss that in the debriefing session. So I think there was a lot of support from different people. So that, enables any simulation center to be, fully functional if you have all that support.
It's like an ecosystem, isn't it? It needs all of those separate parts to operate. Complex system.
True. Very true.
Yeah.
Was there anything that you maybe overlooked, or was there anything particularly challenging about the project, or something that perhaps, what were the biggest challenges, I guess?
I think the biggest would have been, to have more faculty development programs, and we could have had more faculty trained prior to starting it. So that would have enabled, because, those who were trained had everything fell on them, and, had to work on it. So, we were like overworked, during that period. It was fun, but I think if we had that, so that would be something, that make sure you have a faculty development plan and, in place even prior to, so that people can be trained and, go through it. The second thing I think is, having the faculty buy-in with the curriculum, because, people like to do things and to change is very difficult. So, there is that resistance that you have from time to time from people who are set in their ways. So we did experience that. And, it took some coaxing and to show, that, things can be done differently,
Sure. So it's a leadership function, isn't it? Essentially, is what you're describing is change management, and So obviously, this was the first centre of its kind that you were instrumental in the design and delivery of. How and what does the simulation landscape look like now in Pakistan? Are you still in touch? Are you still?
It's going very well. Many more are in the simulation centre now. I've always loved to read the newsletters and you see how they are progressing. They've been able to have a conference recently, which is very good, something that we thought about, but, it's actually implemented. So that was good. They've also been able to, expand. And I think it's because it's a resource for the nation. There are other people in Pakistan who are also ready now to, open simulation centers and, do that. So I think we've been like a role model and, we kind of set the stage for simulation in Pakistan.
Correct. You must be so proud of the project.
I am. It's like my third son.
Well, so from there, or sometime after that, you moved to the University of Sharjah, and that's how you and I first met. How does operating in the UAE, doing the roles that you have involved in simulation, how does that compare to the kind of the Pakistan context where you were teaching in before?
I think we've done it here. I do not have a simulation center that's in the pipeline, and they will be developing one year. But for now, we use the resources that you have. So we have 4 skills lab and we have mannequins there, high fidelity mannequins. And like I said, with our maternity, the boys, 80 boys in the maternity course, we're using simulation big time, And what we've done is we've been able to offer them that course. We use collaborative learning. So I think the experience that I have, I've been able to transfer it here. And I think I'm making it more, viable for them, more enjoyable for them. And I think, with time, you get that, you get that edge that what needs to be done, what doesn't need to be done. So I think the scenarios that we've developed, if I look at what I have done in the past and what I do now, it certainly has the simulation touch and the high fidelity touch. I've also been able to do a lot of faculty development here in terms of the programs that we have. So I offer it as part of the advanced diploma here in the medical education department. I'm also, when we teach in the Masters in Leadership and Health Professions, I teach with some of you, Emma and a couple of others. We've taught simulation in our courses as a teaching learning pedagogy. So I think that has enabled me to, have a broad-based kind of knowledge. And also now I come with experience. It's not like I've based just from the theory book. Now I bring you the experience. So I think in that way, I believe I've come a long way.
And as you were saying there about including some of that simulation-based education training into some of your healthcare leadership and healthcare education programs, how important do you think it is that these types of programs, of which there are masses internationally, how important do you think it is that they include simulation-based education as part of health and medical education now?
In my opinion, Lawrence, I think that they need to do it. And everyone cannot have the same opportunities, and we know that. So I think when we have a curriculum, we know what the outcomes are. We should provide people as close as possible to the outcomes of the program. So if it's not available, and they're not able to see that, they can do it through simulation. And as long as you make the simulation to mimic as close to reality, I think you can achieve the objectives. And today there is the move, there is things that people can do. So, whether you want to have, a community set up, you want to have an, emergency room set up, you want to bring an ambulance, and how they take the patient right from the emergency room till they are discharged and back into the community. So I think this way we're able to give, students a standardized experience. And for me, that's important because when you actually go into the real world, you never know what you're going to face. So that way, we're able to impart that knowledge through the simulation, modality.
And health and simulation as a pedagogy for healthcare education, for educationalists, for instructors, I think is invaluable as well, isn't it? Because just like you were saying, Jackie, about the standardization of experiences for learners, I think equipping healthcare educators with simulation, underpinning simulation instruction or leadership skills or facilitation gives that standardization of quality. There's so many transferable skills, isn't there? If you learn how to debrief with good judgment, how to understand the brief, the simulation event, the debrief as well, it just makes you a better educator all round. Of that, I have no doubt.
Absolutely. And I think that's one of the things that I've seen is that as long as students know, that they're practicing in a safe environment, they can, make as many mistakes as they want. They're accountable for their actions, learning will take place. But I think it all depends very much on the facilitator, how you present that information to the student. You don't want to reprimand them. You want them to grow, but at the same time, you want the transformation of learning to take place. And I think that just comes with experience and, for people to understand. So I think that's one of the highlights of simulation, that you can still have learning, but you can have it in a psychologically safe space.
So, Jackie, you've hinted that a simulation centre might be on the horizon for you at Sharjah. Can you give us any more insight into that? Is this something that's a concrete?
Really. It's
no,
we've
not
had
really.
a couple
Are you
of
rubbing your hands with glee at the thought of it?
Yes, but I know it's there because we've all put in our needs of how many rooms we need and what will be the equipment. So so I hope the next time you come here to University of Sharjah, we can show you the ground.
Well, how very exciting and how interesting as well to have been able to draw on all of your experience and to relate it to our own in what we've tried to achieve here in the School of Health Sciences at UEA. So we probably better think about how we kind of bring this one kind of to something resembling a conclusion, and perhaps what would be really useful for everyone listening or watching would be just to hear what your wisdom would be and what kind of takeaway learning outcomes, shall we say, if we're going to close this debrief, what would your advice be to anyone setting up a simulation centre now?
Thanks, Lawrence. I think what I would look at as takeaways is, number one, you have to have the mission and the vision to have a simulation center. So that's the first thing. The next, you would have to have the buy-in of your stakeholders, the management, the governance structure. I think that's very, very important. If you have the governance structure, then, things will fall into place. Once you've got that in place, then I think simultaneously, you're looking at think big, and I would say, look at what your curriculum is going to be like. Where will you fit it into the curriculum? Is it going to be at the beginning, the middle, the end? How does that, translate into your learning objectives and learning outcomes? And then faculty development. I think a key ingredient is faculty development. So if you have the buy-in is fine, but the faculty need to invest their time. It's like writing a publication, right? I mean, it takes time, right? To write a publication, you do your literature review, you do that. Well, this takes time. I mean, writing the script, getting, the content experts to look at it, vetting it with other colleagues. It's like a similar process for, people have, if they want to use simulation as a teaching pedagogy. And I think that will enable people to realize that if you really want to do, simulation in today's world, then, think big. And I would say the last thing, which I believe has benefited me, is our partnerships and linkages. So, the earlier you form partnerships and link, just like with you two gentlemen over there and others, all over the world, I think that helps. Attending conferences, sure, it helps, as well. Subscribe to newsletters, things like that are there on simulation. Yeah. So, you can do that. Forming us in associations, these things help. So I think that would be my takeaways from this.
Being part of that simulation community, which again just seems to be so welcoming, doesn't it, as an educator?
Well, Jackie, thank you so much for your time coming on today's podcast.
It's my pleasure. I've enjoyed it as much as you have.
Good. Well, you must have enjoyed it a lot then, because I've had a lovely time. So thank you so much. And thank you as well for listening in to SimCast. We hope you've enjoyed this episode, and we hope to see you on the next one.
Thanks, everyone. Bye-bye.